Hello, everyone. My name is Chiz, and these are my classmates, Kenny and Carlos. And today we will be going over the basics of diphtheria. So, what exactly is diphtheria? Diphtheria is described to be a contagious disease that affects your nose and your throat. Specifically, what it does is that it kills the tissues that are a part of your nose and throat. And these dead tissues accumulate, which causes it to be difficult to swallow, like foods or fluids, or it can make it hard to breathe, whether through your mouth or your nose. Now, specific symptoms of this diphtheria, if you do have it, can include fever, in which you are feeling chills all around your body. It can be muscle weakness, so you're not feeling as strong as you used to, or you are getting swelling all over your body, whether it be through your throat or your hands or anywhere. Any kind of swelling can indicate that this disease is in effect. Now, however, we do have vaccines to protect against this disease. So we have three types. So the first one is called DTaP. DTaP is used to protect against diphtheria, but also it can be used to protect against tetanus and whooping cough, also known as pertussis. Whooping cough is typically does happen around children. And DTaP is subsequently also used for children under the age of 7. Our second vaccination is called Tdap. This protects against the same diseases we talked about in the first vaccine, but it is used for people over the age of 7, including children. So adults, teens alike will be using Tdap to protect themselves against this disease. The last vaccination is called TD. Now, TD does not protect against pertussis because pertussis only happens in children. However, it is used for people who are also over the age of 7, but unlike Tdap, TD is used to maintain immunity from diphtheria. So it's kind of used as a maintenance since you need to be protected against the vaccine every 10 years to maintain your immunity. This is what TD is used to do.
Okay, so how does the diphtheria vaccine work? The vaccine injects an inactivated diphtheria toxin into our body, but this does not cause any disease. This just causes our bodies to begin making antibodies in response to the bacteria so that the antibodies can destroy the bacteria now and any time in the future that the bacteria is exposed to us. The antibodies are proteins that counteract a specific antigen. The antigen is the diphtheria, and the antibodies produced will remain in the body in case of future contact. Vaccine side effects. Side effects of the diphtheria vaccine are rare and usually only cause mild symptoms, nothing too harmful. Maybe like common side effects may include soreness, fatigue, swelling, itchiness, loss of appetite. Nothing dangerous, just few mild symptoms. Serious side effects are much less common and are only known to occur in less than 2% of cases. Very unlikely, but if they do occur, they are more serious, including nausea, vomiting, diarrhea, headaches. So in the hospital settings, you should expect common side effects. Nothing too much to worry about, but if serious side effects occur, like nausea, vomiting, diarrhea, headaches, that should be taken into account. It should be noted down. Here, who shouldn't get the vaccine? In some cases, being given the vaccine could be more harmful than not receiving the vaccine. Vaccine protects you from the bacteria, from the diphtheria, but the vaccine itself shouldn't be administered if you have these things. If you're allergic to any of the ingredients in the vaccine, if you've recently been in a coma, if you've been experiencing seizures, if you're known to have severe adverse effects, or if you have developed condition.
What was the impact of the vaccine on society? Before vaccination in the 1920s, between 150,000 and 200,000 cases were reported annually in the U.S. Vaccination provided protection from the disease or reduced its severity. Since then, the number of cases has been reduced by 99.9% in the U.S. It is now considered an uncommon disease in the U.S. Our question to you now is, which combination vaccine is used for children under the age of 7? Is it A, the Tdap vaccine, B, the DTaP vaccine, C, the TD vaccine, or D, all the above? The correct answer is B, the DTaP vaccine. The DTaP is a 3-dose series at age 2, 4, and 6 months, followed by booster shots at age 15, 18 months, and 4 to 6 years old. Here is some data of reported diphtheria since the 1920s. On the y-axis is the number of reported cases, and the x-axis is the corresponding years. Before there was vaccination for diphtheria in the 1920s, 150,000 to 200,000 cases were reported annually. After the vaccine became available in the 1940s, the number of reported cases began to decline. From 1996 to 2018, only 14 cases and 1 death were reported in the U.S. Here's some patient education on the diphtheria vaccine. Adults should receive a booster dose every 10 years to maintain immunity, and redness or swelling can occur where the shot was given. Side effects include soreness, fever, or headaches. And here are resources used for this video. Thank you.